Mr. President, what is also truly concerning here about the current legislation is a massive reduction in care our seniors will face under this legislation. The proposal includes $120 billion in cuts to Medicare Advantage, nearly $135 billion in Medicare cuts for hospitals that care for seniors, more than $42 billion in cuts from home health agencies, and nearly $8 billion in cuts from hospices of all places. This nearly $500 billion in Medicare reductions, I believe, simply has to result in vast reduction in the quality of our seniors' care. Mr. President, I do not believe massive tax increases, a rise in the cost of health care premiums, reduced flexibility and self-management of care, and cuts to seniors' health care is what the American people have in mind as a way to improve access and create affordable, quality health care. Mr. President, we've already seen how this legislation will significantly increase costs and reduce coverage of care. But for a minute, let's turn our attention to the quality of care, because there is indeed a big difference between government-run health care coverage and actual access to medical care. As Margaret Thatcher once said, the problem with socialism is that eventually you run out of other people's money to spend. Medical rationing is inevitable under the government-run health care. It has to be. Supporters of government-run medicine often cite Canada or Great Britain as models for the U.S. to follow. Yet medical rationing, such as is common in those countries, is inevitable under a government-run health care system as now proposed. These countries are forced to ration care or, in the alternative, have long waiting lists for medical treatments that lead to the same result. More than 750,000 Britons are currently awaiting admissions to the National Health Service hospitals. And last year, over half of the Britons were forced to wait more than 18 weeks for care or treatment. The Fraser Institute, an independent Canadian research organization, reported in 2008 that the average wait time for a Canadian awaiting surgery or other medical treatment was 17 weeks, an increase of 86% since 1983. Access to a waiting list, Mr. President, is not access to health care. A study by the Organization for Economic Cooperation and Development showed that the number of CT scanners per million in population was 7.5 in Britain, 11.2 in Canada, and 30.2 in the United States. For the MRIs, there was an average of 5 MRIs per million in population in Britain, 5.5 in Canada, and 26.6 in the United States. Government-run health care will undermine patients' choice of care. Mr. President, citizens in those countries are told by government bureaucrats what health care treatments they're eligible to receive and when they can receive them. Americans need to understand, I believe, that all countries with socialized medicine ration health care by forcing their citizens to wait in lines to receive scarce treatments. Simply put, government financing means government control, and government control means less personal freedom. And while we need to enact reforms to our health care system that will reduce cost and improve access, our nation cannot withstand the deep deficits this colossal health care entitlement program, I believe, would create. Instead, Mr. President, we need a system that restores the patients and doctors as the center of every health care decision, rather than the government and insurance companies. Mr. President, by making insurance portable, expanding health care savings accounts, reducing frivolous lawsuits, emphasizing preventive care, reducing administrative costs, and making insurance more affordable to small business and individuals, I believe we can efficiently decrease the costs that currently burden Americans while expanding coverage. The result would be improved quality and affordable care for all Americans. Mr. President, it appears that no matter how many thousands of letters my office receives here in the Senate asking Congress to stop this type of legislation, this administration is determined to pass something, anything, no matter what the cost or how damaging the result. The latest CNN poll that I was shown shows that 64% of Americans oppose this health care reform is now written. And the Associated Press reports that over 60% of Americans are against this type of reform. It has been said that Mr. President, that we would be committing senatorial malpractice to pass legislation such as this. I agree. I simply do not believe the American people desire or deserve what government-run health care would result in: higher taxes, larger deficits, and ration lower quality care. And while we need, Mr. President, finally to enact reforms to our health care system that will reduce cost and improve access to all Americans, our nation cannot withstand the massive cost this colossal health care entitlement program would create. Mr. President, the health of this nation will not be helped by risking our nation's financial well-being. It has been said, if you think health care is expensive now, wait until it's free. I yield the floor.